Okay, I'm here to do my injectables for my med video. First off, I'll wash my hands. And then I will check my physician's orders with my MAR. Okay, I have morphine sulfate 15 milligrams IM stat, morphine sulfate 15 milligrams IM stat, ampicillin 375 milligrams IM now, repeat dose in 12 hours, ampicillin IM now and repeat in 12 hours, 375 milligrams. Lanoxin, 0.125 milligrams PO every day. Lanoxin, 0.125 milligrams PO every day. MPH insulin, 16 units, and regular insulin, 9 units, subcutaneous AC. Let's see. MPH insulin, 16 units, and regular insulin, 9 units, subQ AC. Proventil 2 puffs every 4 hours while awake. Proventil 2 puffs every 4 hours while awake. Acetaminophen elixir, 650 milligrams PO every 4 hours. PRN for temperature above 101 degrees Fahrenheit. Acetaminophen elixir, 650 milligrams PO every 4 hours as needed for temperature above 101 degrees Fahrenheit. Tuberculin test, 0.1 mils ID now. Tuberculin test, 0.1 milliliters ID now. And then the rest were up here checkups. Okay, so I compared the doctor's order with my MAR, so now I can put the doctor's order away and use my MAR. So I want to make sure that I have the right patient, the right dose, the right time, the right technique, the right documentation, the right drug, and the right, the right route. So, okay, so I've checked this, so now I will go and assess my patient, and then I'll come back and pull all my medication. Good morning, Mrs. Jones. My name's Allison, and I'm a student nurse today. I need to check your name band with my paper right here. Can you tell me your full name and your birth date? Okay. Okay, so that matches, so we're good. Are you in any pain right now? You are. If you had to rate your pain between 0 and 10, 0 being no pain and 10 being the worst you ever had, what would you say yours was? About an 8? Okay. Your doctor's ordered some medication for that, so I'm going to go and prepare that up. Do you have any allergies to medications? No? Okay, that's good. I will be back in just a couple of minutes and do that. At this point, I would assess her temperature to make sure that her her temperature was over 101, and so, and it is, it's 102, and so she would qualify for the other, but right now I'm just doing my injectables. So I will wash my hands again and pull my head. And then I'm not doing my Lanoxin digoxin one right now, but if I was, I would also be listening for her integral pulse before I get to that, because it needs to be above a 60. Her heart rate needs to be above a 60 for that. I would, however, before I gave her the morphine, I would check her respirations to make sure that they're not depressed, because the morphine would depress her respirations. So while I'm still in her room, I will check her respirations just to make sure that they aren't. Check the others. Okay. And her respirations are 16, so that would be good too. Again, I would also, while I'm here, check her blood glucose to make sure that that is in line with receiving insulin, because you would want to give her the insulin if her blood glucose wasn't within the right line for that. And I would also make sure with the insulin that her tray is ready to be brought right to her. So now I'm here and I'm going to check my MAR again and check my medications as I pull them. The first IM is morphine sulfate, 15 milligrams, IM stat. This one you can do in two different. We have the Carpijet, and I would check that this is morphine sulfate. This is actually 20 milligrams per 2 milliliters, and so I would just show how to do this one. For IM injections, there are 3 sites that you can use. You can use the deltoid, but you don't want to give a shot that's more than 1 mil. And to find that, you would do 2 to 3 fingers down from the chromium process, and then V, and then you would give the shot right in there. The next one that you could give is the vastus lateralis, and that's this is a 3. Can you see that? Mm-hmm. This is 3, and then this would be 3 milliliters too. This one is hand breadth from your hip to your knee, and right in here, but on the side, not on the top, on the lateral side right there. And then the last one, your gluteus, dorsal gluteal, you can, your thumb needs to be towards your pelvis, and then your hand right here, your finger towards your iliac crest, and then your shot goes in right there. Okay, then for the sub-Q, you can give those on the backs of the arms, on the shoulders, on the stomach, tops of the legs. Hers I would give.
Miss Jones, your phone's ringing.
Hers I would give in her abdomen, but I would stay about 2 inches away from her belly button. Give it around there. The size of the needles, you can use an 18 to 25 gauge syringe, and 1 to 1.5 inches in length. Okay, the morphine is, like I said, this is 20 milligrams per 2 liters, and it expires 3 of 14, so we're good with this one. And because she only needs 15 milligrams, then you have to do the math for that. Can you see that?
Yep.
So that's my math. Okay, that's my math for the morphine. Like I said, here's the Carpijet. This one has 2 mils in here, and because this is a high-risk drug, this is one that you need to, I will need to waste some because she is getting 1.5. Make sure there are no bubbles in there, and there aren't. So I have to show in front of the nurse that I am wasting this. Try not to squirt my patient or you. Okay.
Yes, I can see it's at 1.5.
Okay.
At 1.5.
Okay. So So then I could go ahead and give that. I'm going to use this ampule to give my morphine. And I would check that this is actually morphine sulfate, 20 milligrams per 2 liters. And it expires 2024. My next drug is the Ampicillin. I am now 375 milligrams. This one has to be reconstituted. This one has, you can go anywhere from 300 milligrams to 500 milligrams. I'm using the 400 milligrams because she only needs 375. I'd reconstitute this with 7.5 mils of water, sterile water. This expires in 2020, 11 of 2020. This is my sterile water. It expires 11/20/24. Then the tuberculin test. This is 0.1. This is the tuberculin vial, and it expires in 11/20/24. So that one's good. Then she gets insulin, NPH, 16 units, and regular insulin, 9 units sub-Q. This is the NPH, and it expires 2020. And this is the regular insulin, and it expires in 2015. Okay, so I will, I'll pull up my morphine, and then I'll show how you can get that. You want to make sure that all the liquid is off of this and down in here. Okay. Put it in here and break the top away from me. Put that in the sharps container. Then I would use a filter needle to draw that up with, because there might be glass particles in there, and I don't want to draw up any glass. Have a bubble in there so I'm just gonna get the extra up. Recap this. And again, where this is a high-risk drug, I would have to show you, so I'm going to have to waste some. And then this out. Paste 1.5. Is that right? Yep. Okay. Can you see that?
I'm zooming in. Roll it a little this way, other way. 1.5.
So I would change my needle out because you're not going to give an injection with that. And I've using a 25 gauge. Okay. And you can give this in a Z fashion, where she would wipe this off from the inside out. Let it dry. And like I said, I checked her respirations, and so she's good to receive this drug. So then you'd use a Z fashion. You just, I would probably give it to her in her dorsal gluteal area. So I would check, make sure that I have the markings right, and pull pull her skin back so that you can get the drug, the best effect for the drug. And then you go down in a 90-degree angle, straight down. Hold for just a few seconds, and then release. In the sharps container. Okay, so then that's that one. So then the next drug I would give her is her Ampicillin. And before I did the morphine and did that, I would have double checked my MAR again with my morphine to make sure that that was indeed the right amount. And so on the Ampicillin, you have to reconstitute. This is the Ampicillin, 400 milligrams, 7.5 is what I need for the sterile water, expires 2020, the sterile water 2024. So I would draw up the sterile, so it's 7.5. There is air in here that is, you can see. You can see bubbles when you're drawing. Okay, there we go, that's better. It was having issues. I'm gonna put this in. Alright, this, while I'm rolling this actually needs to have a math done with it because they want 375 milligrams now, and this is, I reconstituted 400. So while this is, I'm trying to dissolve all this powder in here. Here's my math. So she would actually get down 0.9.
Got it.
Okay. So then I would take it to her and check it again. Make sure that this is the Ampicillin, and it expires in 2020, and she gets 0.9. This one I could get in the deltoid, but because it's so close to the 1, I'm going to give it in her vastus lateralis, in her leg. So my third check was checking with my MAR and checking my bottle again to make sure that it's the right amount, the right expiration date, right dose. 0.9. Also with my IM injections that I failed to mention when I gave my first one is when you give the injection, you want to make sure that you draw back a little bit so that there's no blood in your syringe, so that you know that you were in the right spot. And I think I'm going to waste this because I should have drawn this up with a filter needle, because this had particles in that, so I'm going to waste that. Pour it up with a filter needle.
Must be the filters.
I know it must be, because it doesn't. There we go. Okay. Okay, here's my 0.8. This one,
Other way.
this one,
A little bit more. There we go.
good, okay. Okay, so wipe from the inside out. And do a Z fashion again. Pull back. This one can give it a 90 as well. And straight down. And then pull back up to make sure that there's no blood. And then you can, there isn't, so then you can just skip the shot. And hold. And you're done. The last one that she needs for the injection, well, it's not the last one. The next one that she needs is the insulin. And like I said, I checked her glucose, and I made sure that her tray's out there ready to give to her. So she gets okay. So I would make sure that this is mixed up really well. And this you have to give pretty quick after you draw it up. You cannot mix the two together while you're drawing them up. So I would set this at 16. Yeah, 16. Okay. And then this one is 9. So I would draw up the 9. Because this is another high-risk drug, I would check it with another nurse to make sure that it is indeed 9. So I'll show my nurse that this is 9. Yep. And then I will draw up the 16. Make sure that
Do you
that's still.
want me to zoom in?
Oh,
on it?
yeah, probably. Well, I'm making sure that's mixed. These are hard to see.
Camera doesn't want to focus. That's at 9.
Got it?
Yeah,
Okay.
it's good.
Good
Good as it can get.
With this, you cannot, if I drew up too much, I would have to start again because you can't push any back in. 25. Okay. Check, and this is 25. Yep. And here's 25. Also checked my bottles again to make sure that this is the NPR. You got that? Kinda. And it expires in 2020.
Can you turn it a little? There you go.
And then this is the regular, and it expires in 2015. And this one I could give in her abdomen, like I said, staying 2 inches away from her belly button. Wait for it to dry. This goes in at a 45-degree angle. In. Drop back. No blood. Actually, on those ones you don't have to. For the sub-Q, you don't have to drop back. It's just the animals. And that wouldn't happen in real life. These are full. Okay. Okay, my last one is the TB. This is the TB vial, and it expires 11/24. I'd make sure that on this it's 0.1. I would drop 0.1.
Okay.
Okay, I'm checking again to make sure. 11/24. And the TB, this one goes right here on your arm. So it's a handbrake from your wrist and your elbow, so it's a really small window, just right in there, and it is at a 12 to 15 degrees. Okay. Double up. Just right in there. And it creates a little wheel on their arm, so you know you've got that in there. Okay. And then those are my, then I would wash my hands. I would go back and document that I gave those injections. I I would also go back and check with my patient to make sure that her pain level is decreasing with the shot of the morphine.